Welcome to the updated Dr. Bernstein podcast. Please check the description for the original sources, and all content is general in nature and should not be considered medical advice.
Okay, sounds good.
Today, we're diving into something that I think a lot of people don't really think about too much.
Right.
It's the connection between diabetes and dental care.
Yeah, it's interesting.
We've got a ton of Dr. Bernstein's, recommendations and thoughts on this, and then we also did a deep dive into PubMed and found some interesting research on this as well.
Yeah, you know what I think is so interesting about this is that Dr. Bernstein, he doesn't approach this in the way I think a lot of people would initially think about it. He's not just talking about cavities. It's really how dental infections can really mess with blood sugar.
Yeah, and he sees this all the time in his practice. I mean, he was saying that pretty much all of his patients over 40
Wow.
have had like root canals and stuff,
Yeah.
like serious dental infections.
Yeah.
And he even tells this story about a 10-year-old patient who had their blood sugar was all over the place.
Yeah.
And Dr. Bernstein was just like, I bet you this kid has a tooth infection.
Wow. That's really interesting because it really points to how important it is to be proactive, especially with kids.
Right.
The dentist in the story wanted to do a panoramic x-ray, and Dr. Bernstein's like, no. Let's just do a tap test first. A
Interesting.
tap test can often find the tooth right away,
Right.
where an x-ray might not show an infection.
It's like when your car's making a weird noise.
Right.
You don't need to take apart the whole engine to figure out
something's wrong.
something's up.
Yeah.
And so they found the tooth.
Yeah.
They extracted it,
Smart.
and his blood sugar went back to normal.
It just highlights how important it is to really be your own advocate or your child's advocate. Like if something feels off,
Yeah.
don't be afraid to say, hey, can we look into this a little deeper
For sure.
than just a simple exam?
And this whole thing really feeds into Dr. Bernstein's thing about prevention.
Yes.
He's all about preventing it.
He's not waiting for things to go really south.
Right.
He wants to nip it in the bud. So he is a huge proponent of flossing or using those little interdental brushes after every meal.
Oh, wow.
Not just once a day,
Okay.
every meal.
Wow, he's serious.
Yeah, and he's also a huge advocate of brushing thoroughly twice a day with an electric toothbrush.
Okay.
He says those things are like the Cadillac of plaque removal. And of course, the regular cleanings every 3 months, no exceptions.
3 months.
Every 3 months.
That's a lot.
Yeah. And he even suggests that, it might be even worth seeing a periodontist,
Okay.
which is a dentist that specializes in gum health and those deeper structures that support the teeth.
So he's really specific.
It's very specific. And I
Yeah.
think that comes from years of seeing
Yeah.
how this plays out in
Yeah.
his diabetic patients.
So that's his perspective, his experience. But what does the research say? We also dug into PubMed.
Yeah, it's really interesting to see where the research lines up and where it diverges a little bit.
Yeah.
So one study we looked at in the Scandinavian Journal of Dental Research didn't actually find a significant difference in cavity rates between people with and without diabetes.
That's interesting. So cavities aren't necessarily
Right.
the main.
You'd think there would be like a 1-to-1.
You'd think so.
Yeah.
Yeah.
But it's not that clear cut. However, and this is where it gets really interesting,
Okay.
a study from the International Journal of Pediatric Dentistry that looked at kids.
Okay.
They found that kids with diabetes might have a lower prevalence of cavities, but they often end up with more severe gum issues. They found that the kids with diabetes tended to have worse periodontal health compared to their non-diabetic peers.
So that's like a important distinction, right? It's not just about cavities. It's like the whole health of your gums and everything.
Exactly.
Yeah.
And that's where I think Dr. Bernstein's focus on maybe seeing a periodontist for those cleanings
Oh, yeah.
starts to make a lot of sense.
Makes sense.
He's thinking ahead.
Totally.
Because you've got a periodontist who's trained to see those early signs of gum disease,
Yeah.
which we know can escalate quickly
Right.
in people with diabetes.
Well, it's like even if the cavity rate isn't that different,
Right.
there's all these other things that people with diabetes might be more susceptible to,
Exactly.
like gum problems.
And then those gum problems
Yeah.
can turn into infections.
Right.
Which,
And
of course...
mess with your blood sugar.
Exactly. And to add another layer to this,
Yeah.
we found a study from MedPAR
Yeah.
that found that people with diabetes tend to visit the dentist less frequently.
Yeah, he's always saying that.
Right.
Like if you're not catching it early because you're not going to the
They're
dentist,
not getting those.
then it becomes a bigger problem.
Those early warning signs.
Yeah, it's like skipping your annual physical, and then all of a sudden you're like really sick.
Right. It's preventative maintenance.
Oh,
Right.
right.
You got to keep up with it.
Yeah, and I think that's where Dr. Bernstein really shines.
Yes.
Because he's like taking all these years of experience.
He's connecting the dots
Yeah.
between what might seem like small things,
Right.
like gum health,
Yeah,
and how it can really impact
totally.
your blood sugar.
And you wouldn't necessarily get that from like
Sure.
reading a study.
What
Yeah.
study might tell you the overall trends,
Right.
but it's clinicians like Dr. Bernstein
Oh.
who are seeing this every day.
In the trenches.
Yeah.
So he's like, I'm seeing this pattern.
And sometimes that real world perspective
Right.
leads to recommendations that seem overly cautious.
Yeah.
But when you really think about it long term,
Right.
they make a lot of sense.
It makes a lot of sense.
Yeah, and it's about bringing those two worlds together, right? The research and the experience.
Totally.
For example,
Yeah.
the research might not say
Yeah.
you have to use an electric toothbrush,
Right.
but his insistence on it makes more sense when you see the research on gum health
Right.
and diabetes. He's like, listen, if you're prone to this, why not use the best tool available?
Exactly. It's like if you're going on a hike in the mountains,
Right.
are you going to wear flip-flops or are you going to wear hiking boots?
Exactly. I think that's a really important message
Yeah.
for anybody listening. Whether you have diabetes or not,
Right.
understanding this connection between your dental health and your overall well-being.
It's cute.
It's not just about a pretty smile.
Yeah.
This is about protecting yourself
Totally.
from a whole host of problems down the line.
Okay, so we've got Dr. Bernstein, who's like this passionate advocate who's
Yeah.
got all this experience, these patient stories.
Tons of
And
experience.
then we've got like the research that
Mhm.
sometimes backs it up and sometimes is like, well, not so fast.
a little more nuanced.
Yeah.
Yeah.
So what's like the takeaway for all of this? It seems like it really boils down to Dr. Bernstein's like his big thing is being proactive.
Yes.
He's seen what happens when you're not.
Right. And he's like, I don't want that to happen to you.
And that's something you can't really get
Exactly.
from a research paper.
No, you can't.
And
It's like that clinical.
it's like he's connecting those dots.
Yeah.
Like something as simple as a little plaque buildup
Right.
can snowball
It
into this huge issue.
It's like, don't wait till the smoke detector's gone off.
Right.
Check the batteries every once in a while.
Exactly.
Right.
And be careful with those candles.
Be careful though, those candles. Yeah.
I think what's so great about these deep dives
Mm.
is that we're not just like presenting
Yeah.
Dr. Bernstein's views and saying, this is it.
This is a gospel.
Yeah, we're saying, here's the research.
Right.
Here's what he's saying.
Mhm.
Compare and contrast.
What do you think?
Have this conversation with your doctor.
Yes.
Ring
Go
all
to your
sorts of stuff.
dentist.
Yeah.
Go to your doctor and be like,
What do you think about this?
I heard this thing about periodontal health. What do you think about this connection?
Yeah,
You know?
yeah. Be an active participant in your own health.
Exactly.
So think about,
Don't just take it at face value.
yeah, think about your own like dental habits.
Right.
Have you ever thought,
You floss
yeah, do you floss? Or is it like a once in a blue moon kind of thing?
every 6 months.
Yeah. Have you ever thought that maybe your tooth is bothering you because of your blood sugar?
Interesting, right?
Yeah.
It's all connected.
It's all connected.
So maybe step up that dental hygiene game.
Maybe. Maybe get yourself one of those fancy electric toothbrushes
There you go.
that Dr. Bernstein likes. All right. Thanks for listening, everybody. And remember to like and subscribe.